So for those of you that don't recognize this little birdie up here, you can tweet me. And if you tweet on Beyond Ebola, actually, you'll get a lot more other folks that are following Ebola around the world as well. So if you have any questions, I know some folks don't like to bring them up in the middle of a large group. And so I always give this out to folks that if you want to tweet a question, nothing's too big or too small, and be happy to answer you. And so start off with, actually, it's really my pleasure to follow Ted Cieslak. Ted and I go back quite a few years, back to the 1996 Olympics, back in the Olympic Games when everyone was planning for what could have been bioterrorism events during that period of time. And so long time ago, I was actually 4 years old. So it's kind of a shock, that I got to work with him, but it was great. And, all kinds of little subterfuge going on there. As a matter of fact, we had Marines downtown near the Centennial Park. We're all being stationed in a winery. And those of you Marines may not get that joke, but I think it might be a little bit of a cruel joke in itself. But basically what they were to do is to actually go out, if anything happened at the Olympic Games, which it did, and they were to go out and do testing like what Ted just talked about and decide whether it's chemical, biological, or radiological, and then the response would come in as well, and so that testing went on. And I was one of those young kids interested in disaster medicine early on. I was an emergency doctor, and I'll tell you a little bit of stories about how I went from that as well. Started off as a disaster victim back when I was 20 years old, tornado, lost my home and everything that I owned, got back into school and went into ER, and then while I was in ER, decided I wanted to do disaster medicine. And my friend said, let me get this straight. So you want to do disaster medicine. That means you'll go back to school for 2 years, and you'll study disaster medicine, which is public health, and you'll make a third of what you make now. And what's that all about, And so I took that path. But you know what? 10 years later, all my friends were like saying, hey, what was Indonesia like? And what was Hawaii like? And so on. So that issue with the Olympic Games, actually, I was in my fellowship studying disaster medicine as a formal fellowship when the Olympic Games unfolded in front of me. So I saw the beginning of the Strategic National Stockpile, saw the counterterrorism moves, and all of that coming out of 1998. 1998, I published the first article on anthrax emergencies and gave the guidelines that Ted Cieslak just talked about of droplet precautions, standard precautions, and so on. That was published actually, I think it was published in 1999. And we were publishing some of these stuff, how to deal with anthrax letters before the anthrax letters were actually released, before you actually heard about them, The reason being is that because my office was responsible for doing the triage in CDC. So you would call our 1-800 number, and we would assign someone 24/7, beepers, remember those? 24/7, people would actually, for those of you that don't know what beepers are, they're never mind, just go buy an album and, vintage it out. So anyway, we were on call, and we were getting a lot of calls about anthrax letters. As a matter of fact, before the anthrax emergencies that you heard about in 2001, we got 1,500 of them. 1,500 anthrax emergency letters were sent out around the United States, and we were dealing with those on a regular basis. So that by the time we were ready to publish those, we had seen quite a few of them and had some protocols established. Oddly enough, they started off in the Planned Parenthood clinics in the United States. Overwhelming majority started off in the Planned Parenthood clinics, then moved to the liberal press, and then moved to liberal senators. So, now I'm not in the government anymore. I retired from CDC after a 16-year career a couple of years ago, so I just wanted to share with you that the opinions that I make are now, that I'm sharing with you, are entirely my own. Finally. So pandemic business and workplace impacts. I'm going to talk to you a little bit about pandemic in the sense of how it impacts our workplace, and not only our workplace, but our businesses, and also on a larger scale, the stock market and business itself. And, a lot of my friends always, every time I'm ready to go back to school, they always ask me, what are you doing? And so here I did this 15-year career at CDC and decided I was going to go back to school to get an MBA. Little did they know I was planning on leaving the government at that point in time, and was really looking at the issues of macroeconomics and disasters. In particular, what I found is I was trying to figure out how we can prevent people from becoming injured to begin with in disasters. Prevention? How many people have heard of prevention? Right? Yeah, prevention's our bay, right? But how do we apply it to disasters, in particular environmental disasters? Preventing epidemics, one thing. Preventing people from dying in a flood is another. So I started looking at that, and I started realizing that actually the government has very little involvement, some guidance to some extent in what buildings get thrown up, what buildings in our communities and so on. But you know who builds these places, who builds in the risk, who develops the risk for us, and who develops the risk with us is business itself. And so business really is us. We are business, and we also utilize a lot of our business skills to either increase risk or decrease risk, and that's what I want to talk to you a little bit about today. So at CDC, I was often asked to do these sorts of rapid assessments, and people would send us in all over the world. That's why I love CDC. My first 15 years was going all over the world. If you heard about it on the news, I was there, and we were doing the first assessments. We were the first ones in, looking at it and saying, what are the needs? And then calling in the health and medical people to come in, to feed people, to shelter them, and so on. So first in, take a quick look at it, and then back out again. And so these rapid needs assessments, sometimes you have all the information, sometimes you don't. That's what people are counting on, is for you to get in there and make that first assessment. And so, of course, Ted was relaying to us how we do that for some of these bioterrorism issues, but I want you to do so with me here now. So I have I have two pictures. Two photographs here, and I want you to take a look at them for me. You, the budding epidemiologist and budding public health officials, and if you weren't in public health yesterday, maybe you stayed at a Holiday Inn last night, you can join in with us as well. As a matter of fact, you get this right, you may be able to actually join Emory University if you have $35,000 a year. So I'd be happy to help you out and plug you in there as well. So take a close look, folks, and here's the game. You raise your hand if I say you think that cholera is in one, or you say it if it's in two. Am I? Oh, no, that's fine. Yes, so please with me now. Who among you think that the cholera outbreak is in picture number one? Can't see it. Oh, you don't have all the information. I'm sorry. Oh, it's tough, isn't it? Are you sleeping on a cot tonight? Did you bring your flashlight? One? Anyone? Number two? Anyone? Okay, there's 4 people that voted. Yeah, it depends. I like that. Oh, yeah, I always liked those essay questions in school, all right? That's why I hated mathematics. Damn it, it's 7.8. I hate that. Okay, one more time, folks. Won't spend much time. 1, raise your hand nice and tall. And number 2, raise your hand nice and tall. Okay, let's see who has it. Number 2 was Woodstock. And number 1 was the Goma outbreak of cholera, one of the largest outbreaks in Africa of cholera. It went on for quite a period of time in a refugee camp. And some of you may know a little bit about cholera. I may have fooled you because I showed one wet and one relatively dry. And the one that's dry is actually because it's on predominantly basalt, so volcanic rock, and they couldn't dig down to dig toilets. And people were defecating everywhere with cholera, and it got out of hand, and they couldn't even get clean water in that area. So a quick view at something is always a very difficult thing to do, and I just wanted to share that with you a little bit as well. Now, number 2, Woodstock. What was their excuse, right? So Woodstock actually is looking into, as in my fellowship, prior to the fellowship, disaster medicine, I was doing emergency medicine at Albany Med, and we had Woodstock 2 at our doorstep. And so my chairman wanted me there to do triage for Woodstock 2 because we were the main trauma center, and he didn't want us full of all the nicks and bumps and cuts. He wanted us to be reserved for the big bad cases that would come out of there. By the way, there were 300,000 people at Woodstock 2, all of them without permanent shelter, all of them just moving into a hillside and staying there. And so this is what ended up after a couple of days of rain during August. Actually, we had 300 cases of hypothermia a night, multiple rape cases, hundreds and hundreds of rapes a day, a lot of violence at that place, completely different than the first one. Of course, you didn't hear that broadcasted because it was a privately held event. We treated over 6,000 patients in 4 days with 25 doctors and 75 nurses, who majority of them left by the 4th day. So here's what we were left with, and I just want to show you this one picture of the public health no-nos, how many of them you can count in this far category over here, this far picture, where you can see this gentleman actually standing by a porta potty, washing, bathing, in the effluent that's obviously to the level of that porta potty. And then if we take another look over here, we can see that he has a water line that's coming through here, but also those are electrical cords coming up out of the water, connecting here. He's standing here, washing in basically E. coli. You can see the whole thing there. And of course, electrical fence carried on down and so on. So how many public health problems can you have at Woodstock? Ours was violence and injury, both intentional and unintentional, completely different than what you would expect by looking at those pictures. But I wanted to show you a little bit about the ideas of when we're looking at these diseases, disasters, and those kinds of events that occur so infrequently, sometimes the misconceptions that we have drive nearly all of our perceptions. And I'll show you how that works when we're talking about disruptors in business in particular. So many of you heard people throw around the word disruptor, and actually it started off at Harvard Business School, and disruptor was actually a good thing and a bad thing. It's really a new business that pops up and sort of displaces other things, and so it can be bad for other people, your competitors, or it can be good for you. But the idea of disruptor is basically that it changes things completely the way that we were working before. And so some of you are examples of Airbnb and Uber and so on. Obviously, disruptors. I'm going to pull off Uber, by the way, and put on Lyft, right? Why am I dropping Uber? Yeah, a few of you know, don't you? So anyway, emerging diseases can be global disruptors is what we really have to recognize. And so we first learned this hard lesson back in SARS. How many of you were born after SARS? So I got to be careful, one time I was talking about the Beatles and people looking like I was crazy up here. So is that the guy that was in Wings? So anyway, SARS, here's these cases of new infectious disease emerging in China, actually originating in China, a small number of cases, and you saw these major losses in businesses throughout the world. Estee Lauder lost business because problems in China with SARS, a few cases. Atlanta Scientific, FedEx, Nortel, and here's a big one as well, Las Vegas tourism. 50% losses in the second quarter. Because of the SARS outbreak. Now, remember, were there any SARS cases in the United States? Never. But Las Vegas lost money. Now, that's hard to do, right? Have you ever been to Las Vegas? Did they ever lose money? Good question, right? AIG, an international insurance firm, also 30% loss of annual revenue. One disease, couple of handfuls of cases. And so it's a big, big issue when we're talking about these emerging diseases. We're not only talking about the health effects, but also certainly the impact on economics. And just to go on with SARS with some more statistics, $6 billion loss in impact on airlines in Asia Pacific and $1 billion in North America alone. And also 300,000 barrels a day drop in purchases of oil. So it actually even translated over into the oil markets as well. So one disease has a ripple effect throughout the entire world, and we need to recognize that when we're dealing with our health, when we're dealing with our businesses, and when we're talking about our communities. And sustainability over time is not only health, but also economics as well. And so now, I've just mentioned here this emerging disease, and I know I'm preaching to the choir here, so I won't spend a lot of time with this, but what I try to get across here is what is an emerging disease, and an easy way to remember it is that it's newly appeared in a population, or that it's been known for some time, but it's rapidly increasing. So something that's popping up, and then we compare this to re-emerging, and re-emerging, they've been around for a while, and now they're coming back. Examples of that, like measles, for example, and previously the emerging, as we talked about, Ebola, SARS, and MERS, and so on. And I know there's a little bit of overlap in these, and depending upon which author that you talk to, they have a different definition. But the main thing that I like to get you to learn a little bit about is just emerging new location, re-emerging new time, but maybe the same disease. And for our practical purposes, that's where we'll stop it here. So I want to talk about emerging infectious disease, those new location diseases, those things that are emerging up. And so this is a great example of how we have economic losses from 6 major outbreaks of emerging infectious diseases over this period of a little over 1997 to 2009, $80 billion in losses. And that's a lot. That's quite a bit of money when you're considering considering that that didn't even include the Ebola outbreaks that we recently went through. So that's a lot of money that public health is spending. It's a lot of resources that people are spending within those countries that could be better used, for example, on simple things like immunizations, safe water, maternal child health. Many of these areas are still battling the third world diseases. Now let's compare those emerging infectious diseases with this re-emerging measles in the United States. So we have this idea of re-emerging measles, and once again, we had this outbreak of years ago back in Disneyland, actually, or 117 cases popped up in 2014. Where it then spread to 24 states. Some visitors came over from Philippines. There was an outbreak in Philippines, carried it over to Disney World, and then it spread out. And was relatively, you can see now the numbers now going down. But the problem is not now in the United States, but now it's in Europe. Measles, for example, 500 cases during January of 2017, even more so now, and endemic in about a third of Europe. And the difficulty is immunization coverage is so low in Europe. Why is that the case? Well, it's because they have a large immigration population that are now coming in from countries that have been under-immunized. So either from the Middle East or from Northern Africa, you have a large number of people that are coming in that are carrying that relatively naive population. In addition, now we're already seeing those current outbreaks in Italy and Romania. We can expect to see more of those, and also, of course, because people can hop on a plane, more cases over here in the United States. And why would we have worry about measles coverage in the United States? Of course, people have difficulty in getting through the ideas of science and science-based medicine when they talk about immunizations. And I'm darn glad that we have a president who now stands up for science. What? I don't get it. So re-emerging, once again, chikungunya. Everyone say that quickly 3 times, chikungunya, chikungunya. So, yeah, you say, where is this? We've never heard of it. Have any of you heard of YAP? Yeah, all right. That's where I first heard of chikungunya, was about 5 or 6 years ago when the outbreak occurred in YAP. And now we have it in Latin America and mostly in the Caribbean area. And the United States was scared about this because we had cases that were starting to spread into the United States. But now, the good news is, since 2016, the cases have halved. So we sort of missed the boat with that one. But once again, re-emerging diseases. And then, of course, you've heard of Zika. You know, the risk obviously depends upon your mosquito habitat, where you are in the country, in the United States, of course, and these travel patterns. And so you can see predominantly selecting the southeastern United States as well. My favorite thing in the morning, of course, after spending so much time in the islands out here, is we actually have a lanai at my house, probably one of the few lanais in Georgia. Everyone else calls it a back porch, right? And you know, a bunch of shells and glass balls out there and stuff, and you know, 5 million different things from the Marshalls. And I also have a big bamboo section down in my yard that I planted. And so I go down by the water in the morning, and that's how I wake up every morning, is sitting in a big batch of bamboo. But Zika kind of gets my wife worried about that. So I don't know whether it's better for me to spray neurotoxins all over my body and go down there, or it is to take my Zika risk. But I'm taking the Zika risk now, so this may be the last time I see you. It's been good knowing you. And, you know, the other thing we need to be concerned about, of course, is now we're talking about H7N9 of influenza, and this is one of my worries. I spent a lot of time working with H5N1 influenza back in those concerns for the pandemic, and actually did disaster planning at the regional and local level in Vietnam, Cambodia, Thailand, Laos, and God else, wherever they sent me. But we were right in there in the local area identifying where cases really were and making plans so that those cases could not get out to the rest of the world and cause a pandemic. At that point in time, we had 150 cases of deaths in Vietnam at the time. But this is one we have to worry about. 924 cases of influenza. Seasonal peaks are growing. Good news is it's limited human-human transmission. So those of you that know a little bit about influenza, one thing is it passes in between animals, passes animal to human, but then when it passes human to human, as it mutates, becomes much more contagious and easily passed from person to person. So right now, very limited human transmission. That's the good news. And why is that the good news? It's because the global pandemic, if this a pandemic, of course, is an epidemic that goes around the world, involves nearly every nation, and certainly this happened back in 1918 with influenza. We know that it can occur. It's also occurred with HIV and some other diseases. So we know that a global pandemic, actually this is dated at 2008, almost 10 years ago, the World Bank was estimating that it could decrease global economic output by 4.8%. Now that's not 4.8% across the board, that's 4.8%, some places getting much, much more depending upon what your dependency may be to other structures. So we can say that, for example, in the developed world, we would probably be taking a little bit bigger of a hit than that. The overall cost at $3 trillion, now we're seeing these numbers go up to $5-6 trillion if we were to hit a pandemic now. And even if you're talking about not pandemic, just the average flu, the flu season itself actually does cost a considerable amount as far as in terms of 111 million lost work days a year, and $7 billion worth of lost productivity. So people staying home with the flu, and I'll tell you, if you're in my office, yeah, stay home, right? We used to send people home. Don't come in and cough your kids' stuff up on me, you know. And so we used to social distancing was a good thing for us, right? Although my mom never knew the social distancing thing, you know. My mom would say, "Oh, Tommy's got the measles. Come on down. You're gonna what would you? You're gonna meet Tommy, right? And you're gonna get the measles." Did your mom ever do that to any of you? Well, you had normal moms, yeah. Okay, right. Yeah, but that was the thing. That was our poor man's Appalachian immunization program. Luckily, not many Appalachians had smallpox, or we wouldn't be such a great culture at this point in time, leading the way in other things like dental health. What? So what I want to tell you of this pandemic, where are we now? You are here, we're in the preparedness phase, and basically mostly animals, few humans, and this is WHO way of really applying a risk assessment that lets us know where we stand and what our relative danger is, so that we are now currently in phase 1 in China with the H7N9, and we should be keeping an eye on that as well. So that's the good news. And the good news is there's still plenty of time as well. And so one of the things, do I have any people from business here representing businesses? Anyone of you own your own business? God bless you. Yeah. So I'm one of those business owners as well. So I feel your pain. I feel your pain, right? That was not a good one. I can do better. I feel your pain. I'm working on that one. It's a tough one to do in Georgia when you got Jimmy Carter looking over your shoulder. So employers, basically, the issue here is the vaccination, the cost savings for the median wage is actually, it depends, really the cost savings here depends upon where you stack in the corporation. So there is a cost savings at the median wage, and so certainly what this study is saying, and this is Lee in the Journal of Vaccine back in 2010, there have been some subsequent studies of this, but basically saying if you're a median wage earner, it's actually beneficial for your employer to vaccinate you and to spend that money because it'll actually be beneficial to the employer. For lower level employees, it's actually about cost even, and if you're talking upper level employees, the C-suite, then absolutely it is a positive thing for cost saving as well. Clear benefit for the higher paid workers. So I'm here to tell you that actually I'm not so concerned about the high paid workers as I am the folks on the bottom, and I love the idea that this is actually a neutral process. And so we shouldn't walk away from the opportunity to immunize the population and to take these sort of no regret options. And so finally, you know, the other thing that many of us don't realize when we talk about pandemic influenza, or we talk about other pandemics as well, is this issue of the supply chains. And boy, do you in Hawaii have a supply chain issue, huh? You do, yeah. You know, I've been coming out here for almost 20 years. I lived out here for a few months at a time for quite a few years. I used to have staff based at Trifbler that I had to supervise. So I came back and forth here, and I was here when we all were waiting for toilet paper. Remember that? And so, yeah, you only have to disrupt your logistics chain for a few days here in Hawaii before you start looking at the leaves a little bit differently. There's my Appalachian coming out, right? You know, now there's not so much red print. You know, everything's on your phone, so you're going to have a lot shortage of the Montgomery Ward catalogs as well. Well, that's an old one for those folks reaching way back now. But anyway, this idea of disruption of supply chain, we really have to think about that in terms of these companies that won't be able to maintain their supply chains. And many of the multinationals, they have that covered. As a matter of fact, twice a year I speak in New York City to the Fortune 100 companies and give them a risk analysis as well. And many of them already have their supply chains nailed down. They're pretty good at it, actually. But what they don't have is their vendor's supply chain or their vendor's vendor. So they may be just fine in being able to get their fixed product back to the market, but what they don't control is where their primary resource is coming from. And so that's why you pull in things like the islands, you pull in things like Thailand. A flood in Bangkok, for example, disrupts Estee Lauder Cosmetics, disrupts Ford Motor Company, disrupts the entire lithium battery market worldwide. Lithium batteries, any of you have one? Yeah, all of you have one, at least one. So if this gets disrupted, bad news, right? And that's the whole idea of rare metals as well. All of you have rare metals in your pocket, right? And that's why we know that there are $3 trillion worth of untapped rare metals in Afghanistan right now, as a matter of fact. Did I just say that out loud? I'm sorry. 85% of companies report at least one supply chain disruption in 2011, with about 50% facing more than one disruption. So a lot of folks are facing these kinds of problems. So let's talk a little bit about Ebola itself. Sorry, I'm not going to talk about Ebola. I just found that slide. It's really cool, so I had to put it up. No, just kidding. So Ebola, one of the problems with Ebola is these nations that were affected had remarkable successes in growth. 8.9% GDP growth isn't such a bad thing when you're in Sierra Leone. But a 2% drop in 1 year is a remarkable change. And that's what happened to all three of these countries. These are the first countries affected by Ebola on the Western African coastline. And you can see all of them suffered remarkably. Their GDPs dropped considerably over this 1.5 year period, remarkably just simply due to Ebola itself. And these factors of economic losses included both mobility. For example, the border closures were really the big one. When people said we're going to close these borders and we're not going to let anyone in or out, they didn't realize how many of these businesses on both sides are entirely dependent upon cross-border transfer. And so about 20 to 75% of the losses in GDP were just due to border closures themselves. Now let me put that into context. What was our plan for the Pacific? For pandemic influenza? Anybody? Border closure. Ring vaccination. Isolation of islands. Right? And that's been an issue in the past, I know. I'm sure I don't have to tell many of you the burdens that islanders have faced of viral infections before. For example, in Koshrai, where 60% of all Koshrians died, the population of Fiji down 50% by measles. Also as well, Ponape, 60% of those folks as well by smallpox decimated. So a big problem with these islands. And then agriculture as well. The disruption couldn't happen at a worse time, disrupted the planting season. Food security dropped as well. Mining down. The Chinese got skittish. They said, look, we're going to start mines there, but now we're not. They closed those down. The financial sector then had no liquidity. They ended up collapsing. And of course, the final thing, of course, tourism, the least of their problems after all. So you can see this was all sort of a cascading effect in these three different countries, remarkable change in their GDP. And what drove the loss? What drove the loss, as you're looking at the guy that I copy my haircut from, according to my daughter. It's fear. Fear drove the loss. And this is actually a publication by the World Bank that says it wasn't as a direct cost, it wasn't a result of the direct costs of mortality, morbidity, the healthcare costs, the caregiving, the lost work days. It wasn't any of that. It was actually just rather that the people were fearful and made decisions that cost them money because of that. There's CDC now. Yes? Yeah, they were lost, sorry. So overall, the emerging viruses are what we've been concerned about, right? They've been the ones that we've addressed in this talk, and I talked about SARS. And now, of course, there's another sort of, by the way, whoever called me, I'll get you back. I saw that 808 number. So SARS and MERS, both of these sort of cousins of each other, different areas of the world. We can see we're concerned about both of them. We've heard about both of them as well. But I wanted to compare SARS to MERS a little bit to show you yet even another mistake, because you can say, well, you know, we've learned from these mistakes, Mark. Certainly we get better over time. You know, they have this saying in disasters of lessons learned. Have any of you ever heard that? Lessons learned? Have you heard that? Do you believe that? Yeah, I've never seen anyone learn any of these lessons. You write them out, you don't institutionalize them, you do them again. So anyway, this idea of lessons learned. So here's the idea for MERS, and I want to share this with you as well. So here we had these outbreak of cases of 36 deaths of MERS. This is an emerging infectious disease that happened in Korea in 2015. As a result of that, the Korean government was very proactive. I mean, almost to the extreme. They right away quarantined 2,500 people, closed down schools nationwide. Very, very quick request for assistance to WHO, which was also unusual. How many times have you, in this health department, asked for WHO's formal assistance in Geneva? Oh, yeah, I would think so as well. We don't ask for assistance too often in the United States, nor does South Korea, in particular, nor does North Korea ask for Carmen Ofenko. So, you know, we can see that this was a relatively unusual event. So how did this play out for these folks? Now, this is where I'm going to take you into the stock market before we go. So you can see here, it started off with a 68-year-old national gentleman who just recently traveled to the Middle East, where he was exposed to COVID. We had this total number of cases of 186 cases, and 185 of them were in the Republic of Korea. But in particular, I want to show you a couple of spots in these charts. So this down here is the Korean stock market. And this up here is it's an epi-curve, right? Yeah. So, so basically, these are the number of cases that are occurring in this particular outbreak, and you can see here is our first case, and here's the corresponding. I've lined up the day of the stock market according to the days of the cases announced. So you can see here. Hey, look, guys. Here's our first case. People sort of waiting to see what's happening. Oh, one case, not a big deal, right? Oh no, the cases, we have more cases, and not only do we have more, but this day, the cases went up considerably, doubled on that day. And watch what the stock market, which was on a trend of going upward at that time, actually leveled off, actually plateaued. Some would even say, depending upon what commodity you're in, that you're already starting to lose money. Then you can see the cases sort of dribbled down into a point where we were back down to that one individual case again. Stock market had a momentary upswing on that one day, and then we announced that the cases are going up, and as you can see, then the stock market started going down, and then a surprising peak, and then the stock market starts to bottom again. So you can see this is, you know, as we would expect, stock market following it. If the stock market's losing money, it's not only just your community, it's not only just those few 186 people, but now it's not only Korea, but it's actually a lot of the world losing money on those things. So what should we be doing about this? I think they should pay. Who's they? I think we should all be talking about public and private partnerships. These are groups that are losing money because of what we do in public health. Who do we turn to for our money? We turn to the government. Why should we be turning only to the government, who has a partial benefit in what we're doing, compared to these multinational corporations who have enormous multi-million-dollar benefit in what we're doing? Healthy people make good customers. They make good workers. They make good employees. They make good leaders. And they make good voters. And so all I would recommend is encourage you to think in terms of what are the equal and, should I say, the mutual benefits of public-private partnerships. And finally, let me give you one example. I did my master's thesis in Vietnam, where I looked at floods in Vietnam. Now, Central Vietnam floods almost every year, and over and over again, problems that public would never get a hold of. But Hitachi wanted an access to the Vietnamese worker market because they're hard workers and they work a long period of time and not super expensive. So Hitachi went down there and built a factory down in Vietnam, and the next year, factory flooded. So they're out, business continuity issues, all that stuff, right? So get smart. Okay, let's build the factory up out of the problem. And then floods, which are almost routine every year, typhoon season, flood happens, factory's fine, village is flooded. People don't come to work, they lose money anyway. Then they got smart. So then they said, Why don't we go to the Vietnamese government and we get a public-private partnership together where we actually set up rain gauges in the mountains and measure the rain before it falls into the rivers and then track it all the way down, evacuate the population in the village that we're talking about, move them to our temporary population holding, which we already have built, and we can't save their homes, but they'll be able to go to work the next day. Do you think they'll want to go to work the next day? Yeah. They wanted to go to work. They were missing work as well, right? Then when the water goes down, certainly there's a tragedy there because we haven't saved their homes, but we haven't lost their lives. And I'm saying to you, this is the answer for public health. We're not so concerned about their infrastructure, not so concerned about the light bulbs and the roads and the highways and the village, the actual nuts and bolts. We're concerned about those people's lives, and you can't drown if you're not in the water. And so those are the kinds of examples that I would always encourage us to look at, not always turning to the government for that advice and that element of expertise. I can't tell you how many times I came in as a federal government. I'm here to help. I'm with the feds, and I'm here to help. Of course, you saw our capes, right? We used to have capes, long, flowing green capes. We come, I'm here to help. And they say, oh, yeah, when are you leaving, right? So that's the idea for all of this. So I'm going to close this. We're actually just giving you a quick dashboard here. We've talked about all those different diseases and how do we put this sort of sort of relative threat analysis here. And so this is only for disruption, looking at the issue of economic disruption. And I want to focus on these bottom two. These are the ones to keep an eye on. Influenza in China, where it may be going over the next several years, could disrupt the Chinese South Asian market, and also Ebola as well. Now we're seeing a few cases now that have popped up over in Congo now, so keeping an eye on that as well. The rest of them, Zika, measles, I think these are ones that certainly concern, but not necessarily potential disruptors. And I think also we're in very good line with SARS, MERS, and chikungunya. Shouldn't see those as disruptors in the next year, but keep an eye on for Ebola in particular, and perhaps even influenza, depending upon its area in China. And a little bit of closing advice. I wouldn't be a good doc without coming out to the Pacific and telling you what to really worry about. And so here is an analysis of 50 years of disaster deaths worldwide. And you can see that 50% are geological. That would include earthquakes, and that would include tsunamis. And then 41% are hydrometeorological, so that's storms, landslides, because those are from rain. Second highest killer in the Pacific is landslides, and number one highest killer in the Pacific of floods as well. And you can see over in the corner here, 4% is actually biological disasters. So worldwide, and even in the Pacific, you're more likely to die from hydrometeorological events like storms and floods and landslides than you are of a pandemic. In addition as well, geological, and I want to emphasize this the most of anything today. I did the America's response to the Indian Ocean tsunami, and I saw what the tsunami did in Banda Aceh and all up and down that coastline. I was on the USS Abraham Lincoln aircraft carrier directing that response, and I can tell you it's been a long, long time, probably, 1954, 56, since we've had a tsunami that's killed anyone in Hawaii. But to see 10,000 people floating in a canal is an eye-opener. And we have to take tsunamis seriously here in the island. And I would encourage all of you as well to think about where you are and what we're doing with these travelers. I go to my hotel room and I find a tsunami evacuation map in the back of my phone book. First off, what's a phone book? And I'm in my hotel room. I've just landed. I've got my brand new Hawaiian shirt on. I got my fake tan everybody comes with, right? I bought the clothes that people think you should wear when you're here. And then the first thing I want to do is look in the phone book, right? Well, maybe not, right? So please don't forget all these other issues that we face. The thing about it is predictable location, location, location. If you're on the shore, then you should be thinking more about this. And finally, I want to share with you one little step of hope, story of hope. So in the Indian Ocean tsunami, Banda Aceh was the large island that was hit, and actually halfway and a little bit closer to the earthquake epicenter was an island called Simalu. And Simalu is a small island, Indonesian island, and actually they had a song there that was started around the 1800s when they had a previous tsunami. And the song was sort of like a children's song, like Mary Had a Little Lamb, that they would teach all the little children. And it went something like, when you feel the ground shake, Mog is on his way, and he's going to come out of the ocean and get you. And so you should run to the high ground. And so this was a children's song. And so here they felt the same killer tsunami. They felt the same killer earthquake occurring, right? And everyone, even the adults, said, what do you do when this happens? Well, we all go to high ground because the song says. And so everyone did that. Across about maybe 80 miles away was the actual city of Shalang, 30,000 people in that city. Now the island of Simalu had 80,000 people. 30,000 people in the city of Shalang, they didn't have the song. They had a beautiful city, well-developed, roads, everything, radio, all those kinds of things. And 27,000 people lost their life in Shalang that day because they weren't warned and they had no place to go, even though had no idea where to go, even though they had hillsides all around them. And when I got there afterwards, there were only 3,000 people left alive. On the other hand, in Simalu, there were only 9 deaths, and all of those occurred at the time of the earthquake. There were no tsunami deaths. So does it take high tech? Does it take the federal government? Does it take the response? Does it take all these other things, all this money and time and effort? No, it takes talking to your children and teaching people and reaching out because it means something in your heart and you want to do the right thing. And if it doesn't mean a grant, then so be it. But that's what we should be sharing. We should be sharing that feeling and that outreach of the information that we can share with everyone. So go home tonight, take a look at where you live, and think about that. Thank you.